Good morning, everybody. This is James Gore. It's Friday, May 8th. Update on where we are with COVID response and opening up our economy, but at the same time, striving forward on where we have achieved on public health and what we still need to do to stay ahead of the game. So first thing is that the governor on Monday announced that on this Thursday, yesterday, the state was going to announce and release guidelines for an initial opening of certain sectors of our economy. Governor did make that speech, did release the guidelines and the criteria. First thing is that we in Sonoma County released last night, we were working parallel to that, an announcement that all retail businesses that are out there that weren't able to operate under this weird essential versus non-essential business structure are able to operate, but for pickup and drop-offs. They are not allowed to open up for foot traffic and for other things in the businesses themselves. And that is for right now. That is the allowance that came out of the governor's office for the first part of what they call phase 2. So what does that mean? That means today, Friday, tomorrow, Saturday, Mother's Day, Sunday, Monday, Tuesday, and going into next week is that retail for clothes, toys, sporting goods, food has already been allowed to do this. Everybody can do this world, move into this world of pickup and drop off. Now, let's take this a bit further because there's some criteria that the governor's office put out that we have to achieve in a local jurisdiction, as in a county, one of 58 counties in this state. And if we achieve those criteria, then we can open up the rest of what the governor's office calls phase 2. Phase 2, those other businesses, let's put into them offices, all of our office buildings. Let's talk about also our hospitality industry. That's everything from opening up our restaurants more with social distancing, opening up our our hotels. This is tasting rooms. This is everything in that area. People keep asking me about specific industries, but this move in the governor's office and what we have been pushing for locally is that we want to move away from classifying this business versus this business and say, if you can operate under social distancing, hygiene, and employee checks and other things like that, it's a risk-based analysis, not this industry versus this industry. So the big thing here is that we have some opening going on right now, which is great for Mother's Day weekend. The criteria put out by the governor's office that we're going to review on Tuesday with our board of supervisors and look at our opening plan for the rest of phase 2. Sonoma County's not meeting all of those requirements yet. One of them was could have no COVID-related death in the past 14 days. We do have a COVID-related death in the past 14 days. The other is there's an epidemiological stability analysis that says we can't have more than one case per 10,000 people in the last 14 days. We do not meet that criteria right now. Our claim with the state and others is that Sonoma County is way out ahead of other states on something called contact investigation. That's really the disease detectives. So say James Gore comes in to get a test and is active for COVID. We have people, staff members right now who work with, if in this case, if it was James Gore, and they contact me and communicate with all the people that I am in touch with and make sure that they get all those folks tested. That's actually the reason that our numbers have gone up, is because we've had a deep dive into contact investigation. The interesting thing about this is that for some communities and some counties that haven't dug as deep into that, their numbers don't show high, so they might be opening now, but the undercurrent is that they might have a lot more COVID cases out there. For us, the reason that our health officer feels confident with our approach is because we are tracking those individually, and then we have isolation and quarantine measures on the back end. So these are not just what an epidemiologist would call community spread, which are cases that we don't know where they came from. These are, from a disease tracking standpoint, really cases that we've tracked, that we can wrap around, that we can do isolation quarantine, that we can do mitigation, and that we can take care of. So there's a lot of conversations going on with the state right now about how we, those of us who don't meet a standard criteria, a number on paper, how that can be taken into account as we open up our economy. So opening up our economy, I want to just address this, and protecting our community are not either or scenarios. That's the most important thing I can say today, is that I am never advocating for us to open up outside of the consultation and the science-based analysis by epidemiologists and county health officials or state health officials. My point is that moving from essential to non-essential, and this essential, non-essential into risk-based, we need to be able to move into that risk-based and use the surge capacity, the testing capacity, the tracking capacity, and all the other stuff that we have moved on successfully to make sure that we own this moment. And when I say own this moment, I'm really talking about the fact that, as the WHO says, is we moved from one philosophy, which was the shelter in place stuff, and that philosophy was to flatten the curve. It was to prepare our healthcare system for the rest of the year and get ahead of the curve so that we can handle that. But then it's also, as the WHO has said, is to embrace this crazy world, which is living with COVID until there is a vaccine or herd immunity. Vaccine would come out earlier than that. There's testing on them right now, a couple. It's all over the place. There's a lot of news reports about potential mutations in coronavirus that could impact that. But the reality is that I want you all to think about a few things. Number one, retail businesses open now for pickup, drop-off, delivery. Next Tuesday, we're going to review outdoor recreation, look at an expansion of park attendance. Think Lake Sonoma. The boat docks at Bodega Bay are already open. So think outdoor recreation, golf, tennis, pickleball, all these other things. That's coming forward on Tuesday. Then realize that we are also on the precipice of moving further into those other phase 2 activities. And we're going to make sure that our work in the county is ahead of the state so that when we meet those criteria, we can jump on them and kick butt and make sure we do things right, appropriately, and in line with safety. So very important times for all of us, not just here in Sonoma County, but all over our state and world. This disease does not care about our jurisdictions as much as we define ourselves as Sonoma County, Marin, Alameda, Del Norte. Well, this is my area. That's not where we're at now. So, it's go time. And I think we're in a good place to move forward. I think it's going to be an important week to 2 weeks. And we got to make sure we do this right, because as an economist, a local economist, Robert Eiler said, is that the most catastrophic thing for the economy would be not just the continued closing, but if we opened and had a spike and had to close again quickly, and if all these companies had a double hit and went under, then we have job rates that just skyrocket even above the depression kind of numbers we're seeing, which are 18% unemployment. Final thing is just a call out there to all of you. Thank you for your patience. Thank you for embracing a crazy world of working from home or trying to find other work. I'm not just working here. I'm parenting in place. I have my kids running around. I'm working on my property, trying to get it developed for fire season, get fuel out. There's so much work that needs to be done. But here's the big point to think about. Sonoma County, 27% of our population is over 65, which is one of the classifications for COVID vulnerable. Let's throw in another 3 to 5% minimum and say that a third of our county has underlying conditions. This means that our neighbors, our brothers and sisters, our mothers and fathers, our kids, many of them, a third of our community, even when we open our economy, are not going to be able to re-embrace that. They're going to have to figure out a new way to live within those constraints. And so we have to be thinking about how to take care of our families, how to take care of each other, how to take care of what we need to do to be able to adapt to this. I want everybody to think not just best case scenario, not just, hey, we release the economy, it doesn't get that bad, a vaccine comes in, and we fix it. I don't want them also to be thinking a worst case scenario. Oh my God, things are going crazy, everything's shut down, and this has mutated and all of us are now in Armageddon. I want people to think about what it's going to be like if there's no vaccine soon on the horizon. What if we have to live within this new reality for not just a few more months, but for another year plus? How do we do that And that is a call out to all of you to give us the ideas on what is the new normal. Thank you very much. Happy Friday. A lot of work coming next week. God bless. Stay strong. Stay patient. Try to wipe off and wash off a little bit of the angst and frustration that we're all dealing with. If you're like me, you find yourself getting a little stinky head every once in a while and frustrated, over frustrated. We can't let that spill over to our kids. We can't let that spill over to our community. Love you all.